We are at Townie Meeting 2016 in Las Vegas on our 14th annual Townie Meeting, and I met a father-daughter dentist, hygienist, and you started telling me something, and I cut you off after 2 sentences of, dude, I'm pulling you in the podcast booth. Don't tell me about this, because you were saying something. We'll start over again what you were telling me.
Howard, 75% of people have gum disease, in spite of our best efforts. So it doesn't mean we're not trying. What it means is what we're doing is not working. What do we tell people, Kerry, about that?
Well, I'll ask my patients and my clinicians, I'll say if 75% of people have gum disease, if that's what you agree the current state is, that means 25% of our patients are getting healthy. Would you go to a lawyer that only wins 25% of their cases? You would say no. So I give them different information. We talk to them about biofilm control. We talk to them about showing disease and showing inflammation in a different way. And then we have microbiology and antibiotic rinses that help to locate the disease, figure out what's causing the problem, and antibiotic rinses to actually help reduce the load of biofilm.
So the problem is that we focus on cleaning teeth. We actually tell people to clean their teeth. We tell them to floss their teeth. We tell them to come in and have their teeth cleaned. And when we do that, we don't focus on the gums and the bacteria, the biofilm that is causing the problem. And as such, it's like telling someone to clean their elbow when the dirt's on their hands. They don't clean their gums, and they get gum disease. Flossing is something that most people won't and don't use. And the latest research by Capel in the Journal of Clinical Periodontology in April last year says this: flossing can only be recommended for healthy mouths, and only if nothing else will fit between the teeth without causing trauma. And that was a look at about 1,400 studies he did on the efficacy of floss. And it's really simple, Howard. Can you hold this for a second? Oh, actually, I have to do it. If you look at how the tooth being this shape and the gum being the shape of a bowl, you can adapt floss beautifully to the tooth. But can you floss the inside of a bowl? And the answer is no, because it can't adapt to it. And at that, you have a space between the tooth and the gum, which is wider than the floss. So the floss cleans the tooth beautifully, barely touches the tissue, and we focus on the few people who floss and look healthy, not the majority who don't floss and aren't healthy and are looking for an alternative. So soft picks and stimulants, interdental brushes are much more effective, and patients will use them.
We also encourage our hygiene teams. As a clinical hygienist myself, I can't now function without doing my periodontal probing and getting all my assessment, but also using something like an interdental brush or cleaner like a soft pick or StimuDent before I start to scale. And then I can show the patient visually, it wasn't just my cleaning that caused the bleeding. You had the disease before, and something like a soft pick or a StimuDent created or showed them the inflammation. Completely changes the outlook of the patient. They really are involved in what it is that they want to do to get healthy. They don't then ask me how much money is it going to cost. They say, how do I get my mouth healthy? Then I bring in the oral systemic link. Then I say, you know what, when you're bleeding like this, we should really do some microbiological testing to figure out what's causing your problem and what the location is. And doesn't it make sense if you had a bleeding on your head, wouldn't you want an antibiotic to treat it? Well, we're going to give you an antibiotic in a rinse and spit method instead of in a pill. So it coats the whole oral environment. Because in dentistry, we do a lot of teeth procedures, but we don't often have something to clean the throat or clean the tongue or the other areas. So our antibiotic is particulate. It's a swish and spit. So therefore, then patients swish it around and gargle, and it could actually penetrate down into the pocket. And we've had studies that show you can reduce bleeding by 86% in pocket depths by 1 to 2 millimeters.
In 2 weeks, and 649 patients did not have their teeth scaled in that study. And the P factor was 0.001. And Dr. Walter Loesch, who's a preeminent periodontist and mentored the person that invented the system, Ann Bosey, did the statistical analysis for us. So what we're saying is what you're doing is important, but you need to do some different things.
Yeah.
And there's some complementary things you can do that shows the patient what's in it for me. And you can do a different type of diagnostic testing, and you can give an antibiotic mouthwash, which is safer than pills and more effective than pills. Because when you take a pill, it dissolves in the whole body, 7 to 8 liters of fluid. Not enough it gets into the saliva to take care of the infection. Now, if you have a bladder infection, you don't rub the stuff on your tummy. You take a pill. And our assumption is for a mild to moderate perio, breath odor, for the bacteremias that occur, and for the oral systemic risk, because all these bacteria are throughout the mouth, you have to take a pill, but it doesn't deliver saliva concentration. If you take the pill, you get 3,000 times the concentration. They swish and spit 3 times a day for 2 weeks, and like a bladder or chest infection, it's going to go away. in 90% of the cases, those being the 5 and 6 millimeter pockets, not 7, 8, 9, 10s. For those, you do want to take an oral antibiotic at the same time and sandwich the bacteria in between. So if the focus of the hygiene is on biofilm and bacterial control, that's why people get healthy. And at the same time, they'll control decay that can be prevented for the most part.
And our antibiotics are not only antibiotic, but they're antibiotic antifungal. So we have nystatin in all of our preparations to help control for the yeast and the other conditions. Our medications also come in a rinse as well as in a cream form for periodontitis or localized pockets, or in particular, the system was invented for breath odor treatment. And so people will come back in and say, hey, Kerry, I've still got an odor in between, my lower left molars. How do I get rid of it? So I'll give them the antibiotic cream that they take home and they apply for 14 days, either on an interdental brush, on a floss, on soft picks or stimulants or something, whatever will work in that area. So then they can do localized treatments as well. But it's really changed our career and changed how we do our hygiene program.
So what city are you guys in? You're in
Toronto, Canada.
Toronto, Ontario, Canada.
Yes.
And that's what is the metro there now? About almost
We have
4 million.
about 4 million people.
So
yeah.
I'm in Phoenix. That's about the same size, right?
I would say so. Howard.
Yeah, and we both have the same retractable roof stadium. Yours is because it's too cold, and ours is because it's too hot. I thought that was hilarious.
Yeah.
So your website is Oravital. Ora, O-R-A, Vital, V-I-T-A-L.com.
Yeah.
So if they go to www.oravital.com, what are they going to do? How are they going to learn more? What does this cost? Walk them to the specifically how it works.
So if you go to our website at oravital.com, you can find out more about our microbiological testing. We have DNA samples as well as gram stain, depending on what offices want to do. You can also watch a webinar that Dr. Hyland and I did just a little while ago that gives you more background on why you might want to think about implementing this, why you would add this as another adjunct to your perio program. And from there, when you get involved with Oravital, there's two different ways. One on a basic, introductory level for $195, and with that you get to utilize our rinses because they all come from a compounding pharmacist, because we want to make sure that no matter where you are, you get the same level of medication and that it's not just compounded at the pharmacy up the street, that they might change the preparations. And you get involved with that through a webinar and through online training. And then we also have a larger package. Why don't you talk about that?
We have a coaching package. Part of the problem is you attend a seminar and you get back and you say, do you remember which we were supposed to do first? Or what am I going to do? Susie's a new person in the office, or Ryan's just joined us. How are we going to train them to take over? And so, Howard, what we do is we have an ongoing commitment to train for $9.95 special for the convention and continuing for townies, where we have ongoing coaching available with a rep by webinar, by FaceTime. We will travel to your place, but then there'll be additional costs to do that. So there are two ways to engage with us.
Do you have the Dentaltown app on your phone?
Not yet.
Not yet.
Okay, because I just went on the Dentaltown app. There's 210,000 dentist hygienists. We have a search bar, which, by the way, that little search bar there cost me $50,000. That's Google search appliance.
Yes.
So it'll search through those 4 million posts in 0.01 seconds. But anyway, I just put in Oravital, and Dr. Andy Weimer says, anyone know about Oravital rinse? A patient of mine has a daughter who has a rare autoimmune disorder caused by strep bacteria, and she realized that the mouth can be a source of.
Can I answer that for you?
Well, you should be answered on the website.
Okay.
You know what I'm going to do?
It's
Here's
called Pandas.
I'm just going to put on comment. I'm going to put here are the founders, and then I'll hit use photo.
All right.
Host. But you should go on there and answer that question.
We will definitely go on there tonight and answer
and that's something I'd say. If you're listening to this and you're have a dental company, you can go in there and search your dental company, and you should be in there. A lot of people, when I started Dentaltown in '98, a lot of dentists were saying, "Hey, Howard, you got to get rid of this guy. He's a manufacturer and he's trying to sell something." Yeah. And I say, well, what is wrong with that? Are you a free dentist? Do you not charge your patients? And I owned Dentist Town, but I named it Dentaltown because I always thought if you took away 500 dental companies, I'd be sitting outside on a rug with a bunch of stuff from Home Depot, and I'd be the worst dentist in North America. And it takes 500 amazing companies for me to look like the high-tech Star Wars dentist I am, and I can't do it without all these companies, and that's why you're a dentist and you're a hygienist, so you can go on there anyway. But all the dental manufacturers should be on there. And the other thing about it, if you sell a product and it's red, and all your homies are saying, "God, I wish it was blue," well, you need to know that.
Exactly.
And
Howard.
so I really
very
wanted the
important.
dental. That's why Dentaltown is about 5% manufactured. But you guys should be on there and answering those questions.
Yeah, do you
We'll
want to
do
answer that about pandas, though?
Pandas is a rare autoimmune disease where children, particularly teenagers, have neurological effect from taking exposure to strep mutans, which occurs in the throat. We had a clinic that treats them in Seattle approach us, and we're the only company that's been able to clear the strep mutans from the back of the throat with an antibiotic mouthwash, and being able to keep these kids healthy for a prolonged period of time. Actually, the whole family has to go through the treatment, because one of the things we don't talk to our patients about is that gum disease is sexually transmitted, infectious, contagious disease, and so is strep mutans, and the strep viridans for them. So by using our antibiotic mouthwash on chlorhexidine, which is at 2%, virtually non-staining, they're able to maintain that type of control. So it makes a big difference in these kids' lives.
And what about HPV and oral cancer?
Well, interestingly enough, most of us don't appreciate how severe infection inflammation is. If you use a soft pick and a stimulant, you're going to have the gums gushing blood, and they're going to do that the same as the hygienist does when she picks up a scaler. And then the patient says to you, "Hey, you did that. Used a sharp instrument. You hurt me. It doesn't happen at home." And the hygienist says, "No, it's because you haven't been brushing and flossing. That's why that's happening. You have disease." And they go, "No, I don't. Doesn't happen at home." But if you take a soft pick or stimulant, put between the teeth before scaling, and if they bleed, they can't deny that they have it. What you'll find is most teenage kids and kids who are in college, they're on caffeine, they're sleep deprived, they're not eating right, they're drinking a lot, and the result is they're not taking care of themselves. So when I see these kids,
described Ryan's
maybe, yeah, you notice he's not smiling anymore. So what I think is happening is we underestimate the severity of the infection inflammation that's there, and these are the people that when they're exposed to the HPV, that virus is able to go in through that wound in the gingiva. And I think that's part of the reason it's spreading so quickly and getting in. If you have healthy tissues, it can't penetrate.
I think, too, when we're talking about HPV or oral cancer or anything else that way, in dentistry, we don't look at biofilm enough. We don't look to diagnose it. We always talk about the treatments for it, but we never go back to showing patients where biofilm is. And I, as a hygienist, really didn't disclose many people until I met Ann Bosey and started with this whole system. And disclosing is Ann Bosey. She is a restorative dental hygienist out of Toronto, and her mandate many years ago was to find out what caused bad breath and how do you treat it. And so her research and how this company founded was on a breath odor treatment and system.
ANNBOSC?
BOSY.
ANNBOSY?
Yeah.
BOSY. Oh,
Yeah.
okay.
Yeah, Ann Bosey. And so she has been around in hygiene for many, many years.
60 years, Howard.
And that's ANNE?
Yeah, that's her there.
Right on.
Yes.
Anne discovered that healthy mouths have breath odor.
Yes.
And it's the biofilm that causes a non-inflammatory condition that causes the problems. In fact, I treat about 2 children a week with breath odor, and 50% of them come from dental homes because they're getting infected by their parents when they come home. And one of them was the grandfather went to school with me, and the kid was in for appointments every 3 weeks. And it took us a year to get the child to a stable state, much less breath odor, and then one more treatment, and we finally got the kid that they had no odor at all. They had a lot of tonsillitis, which are infections in the back of the tonsils that pop out at times and cause great distress for people. But the same bacteria that cause breath odor cause periodontal disease. And what Anne was seeing was a 90% treatment and cure with breath odor in about 2 weeks with her system. And we started to see the same thing with periodontal disease. And so now we're suggesting it's a good adjunct to use to the therapies that you do with them. For instance, you put an implant in and you don't control the biofilm at the back of the mouth, Howard, the bacteria hop from your throat back into your implant. And 3 months later, you start to get infection even though you've cleaned the gums. If you do gum surgery and you haven't taken care of the biofilm throughout the mouth, they get reinfected again. So by doing this, you can get a lifelong stability compared to traditional methods.
I like how your website is you're the chief gum guardian.
Well, we started a website called Gum Guardians.
Oh, really?
To
Yes.
provide...
So different than oralvital.com.
Yeah, it was
Yeah.
intended to be for patients to go to as a site where they actually got information, not click here and our office will tell you more. So we put articles up there, we wrote information about how to maintain your mouth there, and we try and encourage people to go to gumguardians.com and to tell their patients to go there. They'll get a generic type of information. It's not about the Oravital System, it's about how to care for your mouth effectively.
Okay, so go back to the Oravital System. So you're recommending testing the saliva for different
I think it's
microorganisms?
I think it's important to consider. There are two ways, because the bacteria that cause gum disease, Michelossi did a study in 2014. She looked at 1,400 brains of patients that had Alzheimer's. 93.7% had one of 5 oral spirochetes in the brain. Now, we know this by another disease, Howard. It's called syphilis. With syphilis caused by a spirochete, you die 40 years later. You die of dementia. On death, Alzheimer's and patients with syphilis have identical brains. So it's the same disease, just it get transmitted differently through saliva as opposed through another type of sexual fluid. If you look at Lyme disease is spirochete disease, and it's a tick bite, and the saliva of the tick gets into your bloodstream, so it's saliva spread again. And most of them have brain fog. 100% have spirochetes in their brain, and 25% die of dementia. On death, their brains are identical to Alzheimer's, syphilis, and Lyme disease. So when we look at a disease, when you see a little bleeding, it's important. For instance, Howard, if you were to go to your physician and you brought in, if you could see blood in your urine, you brought a urine sample in, and you could see blood in it, and your physician said to you, Howard, there's a little bleeding, come back in 6 months, you'd laugh at him. But what do most dental hygiene visits end with? I want you to do a little better, there's blood. Well, what's the difference between blood and saliva or urine? It's the same thing. It's the same disease.
Well, I've been saying since 1987 that the American Dental Association and the FDA should ban all red toothpaste.
Yes.
Because I've had so many patients say, well, when I brush and I spit into the sink, I see blood in my toothpaste. And I think, that's not going to happen with close-up.
Correct.
It wouldn't happen if you were spitting into a red sink.
Correct.
And they all got white porcelain sinks, and toothpaste should only be white. And that is why I miss the cuspidor. Because when
I have them, I love it.
the customer is the greatest thing, because when you would set the patient up to spit, he would spit in that white bowl and see all that chunks of red shit and say, well, what is all that?
Yeah.
And now we're high-speed vacuuming so we could do our assembly line cleaning faster.
Yes.
And the cuspidor is, I miss that thing. I got to tell you a story. When I first opened my practice, you can't even make this up. The coolest, nicest dentist I was in Ahwatukee. He was right next door in Scottsdale, and he was always at the Scottsdale City Club. And when I first met him when I was, 24, he probably would have been 70.
Okay.
Nicest dentist. He uses cuspidor for an ashtray. And his cuspidor had 200 cigarette butts in it. And he smoked a pack a day from 8 to 5 while working on his patients. I mean, there were just different times.
Oh,
Just totally different times.
Yeah.
Now, 30 years later, there's no cuspidors and there's no smoking dentists in the dental office. I haven't met any. I don't know. Maybe in Canada, do they have any?
We were very anti-smoking in Canada, for sure. That is guaranteed.
Especially me. I could tell you stories that way. I'm telling you. But we're writing an article for Hygiene Town, and it's entitled Periodontal Disease is the New Secondhand Smoke. Because if you're kissing people with periodontal disease, you're giving it to your closest people, and you shouldn't be doing that. So we're getting back to the testing.
And just to back up, I just read this year that with DNA testing, that they traced the streptococcus and mutans in our mouth to 15,000 years ago, jumped to us from a cat. And they think in the Fertile Crescent area.
Absolutely.
Did you see that, or isn't that amazing? Which is so ironic because my two best friends are my two cats. And I'm like, this is kind of a symbiotic relationship because it was you two who created my entire my entire profession. I wouldn't have a job if you two wouldn't have kissed a human 15,000 years
We can
ago.
make sure your cats are healthy as well as you're healthy, so you can have as much relationship as you want.
Use our rinses on the cats to get rid of their cat's breath odor too, if you want to do that. It works. It works the same bacteria. But testing. So when we look at the oral systemic link, 37% of blood clots and heart attacks have live P. gingivalis. 100% have pieces of it. You start to realize a little bleeding is important. And if you look, do your patients have diabetes, hip and knee replacement, valve replacement? Have they lost teeth? Are they going to put an implant? Testing becomes an important thing to do. You can do it two ways. You can do a sampling by getting a microbiological slide with us, and you can do 3 or 6 sites. So you can tell site specifically what's happening with a gram stain. Second way would be to take a paper point, a little pad we use, you put it at the back of the tongue, wipe it forward, dip it in saliva, wipe against the lingual surfaces to pick up supragingival, subgingival saliva, and subgingival biofilm. $75 for the first 10. We tell you about 6 periopathogens, yeast, and strep mutans. So you get a whole biofilm analysis at low cost. Yeast is a big component we don't think about. Early childhood decay, if you don't have yeast, you don't get early childhood decay. Geriatric root decay, you don't have yeast, you don't get it.
Is geriatric root decay root surface caries?
Yes, it is. But we're talking about geriatric, where you get this widespread decay around the root surfaces. And when we look at periodontal path, when we do the testing, because we always test for yeast, most people that have periodontal disease have a yeast infection. So that's why we put nystatin in our rinses. So when we control the nystatin, the yeast and the periopathogens, people get a lot healthier than just an antibiotic alone. So it's a different approach to periodontal care.
Do you also believe in the theory that, a lot of people, fighting gum disease and decay, they're spending all their time brushing and flossing their teeth, but then they don't do anything to their tongue, and there could be a billion bacteria on their tongue. What are your thoughts on that?
I completely agree. That's part of why our whole system is about disinfecting the whole mouth. So part of our treatment when we talk to offices, when we coach offices, is to also have them clean their tongue. So any time of tongue scraper usually is enough to clean off the biofilm, and you've got to do it every day. Some people will build quite a film. Other people won't have any. Part of it's to do with stress, genetics, all the rest. But moving the bacteria around every 24 hours so they don't have a chance to colonate and grow as quickly is our key. And making sure patients and our clinicians can see the plaque. I didn't realize how much plaque maybe was even on my patient's teeth until I started disclosing on a regular basis. And now I disclose every patient so then they can see what they have to do. They've got a better chance of doing it, and it helps with motivation. So I don't feel like I'm constantly selling perio care. I'm selling health. And patients are buying it because they see what's in it for them.
The focus is on wellness, not on cleaning your teeth. And when it's like that, the people trust you, they believe you, they like you. But if you can't stop the bleeding, Howard, you better not bring it up.
It sounds like, so we, on the Dental Town app, on the website, we put up 350 online CE courses. They've been viewed over 500,000 times.
Yes.
They're just sounds like you guys should make an online CE course.
We'd love
have you
to.
met Howard Goldstein?
Heard him today.
But no, we haven't met him actually.
Yeah,
no.
he's in charge of our online CE. But so we have Hygiene Town, we have Ortho Town, and Dental Town, and you use. I mean, this is a lot of information.
Oh, I know, that's
a
what
lot of
everyone
information.
Howard, it's almost overload. People are just going like, you told me to stop people to stop flossing. What do you mean? Don't brush
How
your
many
teeth.
years you been doing dentistry?
40.
40 years. Really,
40
40? Congratulations! I'm
Thank you.
coming up on the big 30, and
Okay.
that's amazing.
Yeah.
But let's be honest. I mean, when I got to go 30 years ago, I never heard of the oral systemic link.
Never.
And now it's prime time. So what do you think of when people say the oral systemic link? Some people say, oh, that's theoretical. There's no proof. And then other people are saying, I don't know. There might be a lot of proof.
I think we're hesitant to jump on the bandwagon. We've been on bandwagons before, low-fat diets, and it turns out that makes you fat. So you got to be careful. But the research study is almost undeniable that the link between what we have in our mouth and the rest of our body is there. And I don't want to sound like one of those chiropractors. I adjust your back, I cure everything. But it is there. And if these bacteria are accumulating and causing these problems, it just makes sense to get them healthy. And when they do, what's the harm? Even if there was no oral stomach link, what's the harm?
What,
We got to stop the bleeding.
What looks like the most? I mean, when dentists tell me, well, there's no correlation to this. My first thought is, well, 100 years. I mean, did you ever read G.V. Black's The Father of Modern Dentistry?
No.
Yeah.
But
Okay. I bought.
Weren't they talking about it then?
I bought all 3 of his books.
Yes.
Autographed and signed by him. I'm talking about a dental geek. I'm not even going to tell you what I paid for these 3 books because I could have bought myself a car.
Yeah.
But the thing I loved reading about it the most is you read Pierre Fauchard, which is like 1700s.
Yeah.
You read G.V. Black, which is like 1898.
Yeah.
And then you're a dentist alive today. You realize that every 100 years, we're at a completely different level. And 100 years from now, we're going to look back at today and think, these guys were cavemen, Fred Flintstones, Neanderthals, because they didn't know all this stuff.
Yeah.
So when dentists sit there and say, when they're so literature pure, it's like, well, there is no evidence that refutes that. I'm like, dude, you just know what you know. We don't know what we don't know. But what do you think looks most likely that someday, what most likely are you convinced that there's an oral systemic link? What diseases are you pretty much sold on now?
2, Alzheimer's and heart disease. Now, Dr. Bradley Bale practices, and he has this guarantee. He says, you will not have a heart attack and a stroke while you're under my care, or I will refund your money. He's given his money back to 1 patient in 10 years. The other people that he asked for the money back, 2 of them didn't follow his program. Do you know what 50% of his program is? You stop all the infection, inflammation in the mouth. He said, if I don't get your mouth healthy, I can't control the inflammation that occurs throughout the body. So I think that's huge for us. Number 2 is Alzheimer's. If we can eliminate that scourge from medicine and the impact it has on people, why wouldn't you try and do something about it? And I think the evidence is overwhelming that it's a spirochete disease, it's oral spirochetes, and they tend to seek out nerve involvement. So if you look at leprosy, Lyme disease, syphilis, and Alzheimer's, it ends up being brain affected and neurological. So I wonder what the impact is on a lot of other diseases, things like Parkinson's, ALS. I wonder what is it that triggered that type of infection. The latest research is looking at P. gingivalis as causative for rheumatoid arthritis. The cell wall protein on P. gingivalis is an identical match except for one nucleotide, which is cleaved off with inflammatory response. It's an exact match for the synovial joint proteins. What has to happen, though, is you have to have a genetic defect which leads you prone to periodontal disease and prone to inflammation. And if you have that gene and you have significant biofilm and inflammation, about 15 years later, you get rheumatoid arthritis.
I notice another thing that's changed since we got out of school is the C-reactive protein test.
Yes.
I hear a lot of physicians saying things like, something might not look right, but they'll say, but you know what, your C1 is perfect, you're not inflamed, so I'm really not that worried. Then other people can go to get a physical and they say, everything looks right, but your C-reactive is high, and there's something there. I'm going to keep running more and more and more tests. So it seems like when they start reading it, that there's inflammation, it's a whole different ball game. Do you agree with that or not agree?
I do, and I think the challenge we have in dentistry, if maybe there's a picture we can show afterwards, I've got it in a couple of slides here, the bleeding index. We underestimate the degree of infection, inflammation in patients' mouths because we can't see it ahead of time. So when we do scaling and see bleeding, we try and convince the patient they have the problem. But if you use a saw pick or Stimident, and show the bleeding. Part of our challenge is that what I'm saying to you, you're saying is just like common sense. But professionals are so slow to react to information they receive and act on it. One of my best mentors, Walter Haley, said, the purpose of education is change. If you don't put it into action, you didn't learn anything. And if you can't treat the cause of problems, don't treat the symptoms. And so we're trying to get at the cause of the problem. In 1982, a young physician stood up in Australia and said, I can cure stomach ulcers. Now, when I went to school, that was perhaps before you graduated, we were taught it was an uptight person, too much acid, and if they only took a break and a vacation and drank milk, they'd be okay. And he said, no, it's a stomach infection. H. pylori is acid-loving bacteria, which grows in patients that are prone to decay. acid-loving, and they swallow it. So he gave himself the infection 3 times and cured himself. It only took 15 years to become the standard of practice. So what I'm saying is, we've been trying to cure the infection but treating the symptoms. And if you don't get at the cause, it just doesn't matter. So the question becomes, is an antibiotic an over-treatment for periodontal disease we don't perceive as a real problem? But when I look at the oral systemic link, I perceive it as a problem. When I look at the destruction it causes in the mouth, and when you have to have gum surgery, implants done, you're getting decay all the time, it's all about biofilm control.
Well, let's switch that, because another thing that's changed in our career, when I was got out of dental school in 87, well, first of all, when I was in UMKC Dental School from 84, 85, 86, 87, the one oral surgeon...
That was 4 or 5 years. You graduated in time, did you?
I graduated, undergrad was 80 to 83, dental school was 84 to 87.
Okay.
But the one oral surgeon that was doing implants back there, everybody in the school thought that was crazy, insane. Ramus bars, sub-periospitals. They called him the butcher. Then I opened up in my practice 87, and the guy across the street was doing it, and everybody was rolling their eyes and calling him a quack, and this was nuts. And now it's all mainstream. But they've been telling us forever that these implants have about a 96% success rate.
Yes.
And then you talk to all the oral surgeons and periodontists, they're like, are you joking?
Correct.
And they're measuring success that the thing's still in the jaw 5 years later, but it's lost half its bone, has peri-implantitis on it. But I would say the most often asked question about dental implants on Dental Town is not what brand, how do you place them, how does the drill bit work? It's how the hell do you treat peri-implantitis? So talk about peri-implantitis.
Well, peri-implantitis...
That is the biggest, fastest growing problem.
We have 2 periodontists doing research using our material now just for this. The first periodontist, Dr. Scott Fromm, I sent him 3 oral rinses, and I sent him a sample of our cream, because the cream, you have to think of Arrestin or Atrodox. It's in a cream form. So you can inject it, or patients can floss it around their teeth, or use a soft pick around their teeth. I said, what happened? He said, well, the first patient, he says, we scaled and root planed, and the teeth were being held in with tissue. He said, but I've never seen the tissue so pink and no bleeding. He said, Jim, there was no bleeding. He said, the second patient, he said, you told me don't give them oral antibiotics. So I peri-implantitis surgery, I cleaned the threads, I took away bone, I sutured them up, didn't give them oral antibiotics. He said, nope, no bleeding on the tissues, pink healthy tissues. I've never seen it like that.
And he gave you the rinse or the cream? Was that?
This is the rinse.
Okay.
The third patient, he said, I had to do 2 implants with a lot of bone grafting, and he said I had to put a membrane in. And he said the membrane got exposed. He says, what you don't understand is that's really bad, because my bone's going to be washing out. I've got bacteria that can get right in. He said they were pink stipple tissues on the margins, so I kept them on the rinse for another week. He said that hasn't happened before. I want to do a study on that. The fourth one was a patient that had a 6-millimeter pocket. He said, I put Arrestin in twice. I've done everything scale and root plane. He said 2 weeks later, the patient said, I want this cream again. He said, why? He says, it doesn't bleed anymore. He said, I probed, there was no bleeding. It was down to 5 millimeters. It was maintainable. So with mucositis, you should be using our cream around the tooth right away to get rid of the bacteria in that area. You have to teach them to use a rubber tip, Howard, like you clean your fingernail, buccally and lingually, firmly. I'm talking pressure. You can't fool around with just rubbing it lightly. And if the tissues are going to recede, they recede not because they cause trauma, because they were infected. I tell them they had swollen, it's like you have beer belly gums, and they go to 6-pack abs in about 3 days when you get rid of the bleeding and the infection. You have to teach the patients to floss implants, but they need to double and triple the thickness of the floss and soak it in an antimicrobial, whatever it is they're using, so that they can keep that area clean. You need to disclose implants on every hygiene visit, and if there's biofilm, you have to direct the cleaning at a 45-degree angle in a circle where they stay on that tooth 5 or 6 times, and then teach them lingually. And I don't mean tell them how to do it. I mean put it in their hand, hold their hand, and show them how to do it, and then they can repeat that at home.
If you've ever watched a patient actually brush their teeth, it's like a magic wand. They hold their toothbrush and they're over here, they move back and forth. So part of our instruction with our clinics and why we like them to get the coaching packages, we can say, hey, your teeth are like a train track. Start over here and don't take off your toothbrush until you get to the other side. If you do take it off, back up to the last station and keep going. And our antibiotic cream and our antibiotic rinse are all antibiotic antifungal. So the medication in the cream that is used for implantitis is metronidazole and nystatin. So it's really, really good.
Well, periimplantitis. So if you have periimplantitis, you have a deeper infection. It usually involves bone. So for that, you want to start the rinse 4 days before the surgery that you're going to do to correct it, because you probably need to do surgery. They're on the rinse during the surgery, and they're going to use the cream if required if you still have any inflammation afterwards. Usually you don't need it.
Okay, I'm going to switch gears completely.
Yeah.
A whole new topic. Orthodontist. Okay. You ask them what keeps you up at night. They're saying, well, okay, you got a kid, he's not doing his home care. I'm afraid if I take off the braces, if I leave him on, he's going to have demineralization around all the brackets. Does that have anything to do with that?
Yes, it does.
From PT
yeah,
valves
it
to
does.
Streptococcus mutans.
The issue is you've got puberty, you've got difficulty cleaning, you have guys more than girls who are just whipping through doing things and waving around, as Kerry says, like a magic wand. You have to have them take responsibility. So you have to talk to them like this and say, look, Mom and Dad spent $6,000. They could go on a big vacation. They could do an awful lot. You have a responsibility now to take care of your mouth, just like Dad goes to work or Mom goes to work, to take care of your mouth. And if you're not doing that job, you're not supporting your parents. It isn't about you. But you have to show them techniques that are going to work. So I take a toothbrush and I cut 80% of the toothbrush off. And I give it a little rabbit brush, I call it, kind of like that type of brush. And I teach them to brush from the gingiva up with the brush to get under the brackets when they're really swollen. And it's soft and they can rub it in circles, it doesn't hurt. You have to teach them to use soft picks, because when the gums are like that, they can get soft picks between the teeth. And then soft picks.
What's a soft pick?
It's a little white thing with a green brush. I think Gum Butlers sell them. That's one brand.
Gum Butler?
Yeah.
Like Butler.
Sun Butler?
Yes.
Sun Butler,
Sun
yeah.
Butler?
Yeah.
Okay. Which used to be...
Oh, geez.
Used to be just gum. I don't
Used
know
to
what
be
it was
gum.
before that.
Sun Butler.
Sunstar.
Sunstar.
Yeah.
That's it, yeah.
So Butler was bought by Sunstar.
I think so. And
Yeah.
what they are is they're like a little soft, little rubbery, almost like a...
Pipe cleaner.
Thank you. That's what I was trying to spit out. And it can just go in between the teeth. The patients find them, they're easy to find. You get them at Walgreens, Target. They're not something hard that you've got to sell in your dental office. They can actually go and pick them up.
Well, I never thought of a pipe cleaner for like under a bridge or in between teeth.
It's
Is
the
that
best
do
thing.
people do?
Oh, absolutely no.
My God.
That only happens in Canada, but not in the U.S.
I never
Trailer
even
parks,
thought about a
Rob.
pipe
Trailer
cleaner.
parks, Howard.
Wow.
What are they gonna do after they
Wow. A
clean the
lot of
pipe
my
outs, you know?
patients would definitely have pipe cleaners. I mean, I am in Phoenix, Arizona, so I'm like, I never realized all those grandpas that are, wow.
Yeah.
I never even thought of that.
Who would have known what our grandfathers used to do using toothpicks was the right way to take care of our mouths?
So how can you be pro dental health and Canadian at the same time when your national sport is hockey, where you just sit around and knock each other's teeth out? How do you rationalize that?
It's good for business. we don't have a meth lab. We've got hockey players in Toronto, so that's what we have instead.
We do high-end
I
restorative
love
dentistry.
that. We got in Phoenix. We have the Phoenix Coyotes,
Yes.
and they don't wear any of their partials or anything during the game. And when they're panning the bench, I swear to God, my joke
Well,
is,
Howard,
I mean, there's more legs than teeth on that bench.
Yeah. What type of women are they trying to attract, Howard?
What kind?
I'm not sure.
But it is a hilarious picture because they're always panning the deal, and you're thinking about who they're going to throw in next, and they're all just sitting there with just edentulous uppers, missing their max.
Have
It's
you not
crazy.
seen playoff games where these guys are spitting their teeth out after getting an elbow and saying, no, I can't go in and get myself, I'll fix it up later, and they go right back on the ice. They're tough.
Yeah,
I think
I
the hockey players are the toughest in sport. I got to
They
give them
are.
credit as far as that goes.
No, they are for sure. So.
It is, and I love if you're going to see a live game, hockey is by far the best live.
Yeah.
I mean, it's because it's just nonstop. Football, it's like, it's always timeout. It's always timeout. It's always time. Hockey it's just unbelievable.
If you ever get up to Toronto, though, come out and see a Maple Leaf game. You will love the fans. They are, even though we may lose more games than we win, we still go in there as if our hearts on our sleeves in hopes that we just might clench one. It's quite fun.
Well, I think, in all honesty, that this is a lot of information, and I don't even know if you could explain this, if you could do it justice in an hour. But I really hope that you meet with Howard Goldstein. I really hope that you put an online CE course, because this has so many implications. The oral systemic leak, peri-implantitis, and the fact that what you said is, you go in these charts, and they've been seeing this lady every 3 months for 10 years, and you have data that she's been bleeding every 3 months for 10 years, and it's like, what are we doing? I mean, and I mean, even in
the same old thing over and over again. It's the definition of insanity.
And even in '87, my teachers used to call perio programs supervised neglect.
Absolutely.
Yeah.
Absolutely.
And here it is 30 years later, and it's still supervised
I get
neglect.
concerned about when you talk about the oral systemic link, that's my concern for lawyers. Because when they start getting on the bandwagon that, did you know it was associated with this and that, and you didn't suggest a program that could do something different, we're in trouble.
Yeah, my
But
goal.
it is the greatest hope for our profession, because this is a whole new focus. Howard, when I start talking about wellness, they listen to me, because I'm talking about what's in it for them, only them. And if you talk one-on-one, and we don't take the time to talk, the patients will pay you to talk. But you got to have it relate to them and specific to them, and it means something to them. And you have to be able to predictably say, what I'm going to do will get you healthy.
Okay, now I want to switch total subjects, and I'm going to throw you under a bridge, and you got to be a good guy. There's a lot of, podcasters are young.
Yes.
This is, I'm a 53-year-old grandpa. I got a 4-year granddaughter. The podcasting isn't a grandpa thing, okay? Yeah. For every one guy that sends me an email, howard@dentaltown.com, just saying, hey, I want you to know there are old guys listening to the show. I get 100 emails, and they're juniors and seniors in dental school. And the rest are within 5 years out. A lot of those kids are sitting there in dental school or hygiene school, and they're thinking about going in with their dad. And you're a hygienist, and you work with your dad.
I do.
And they're kind of stressed, because they're like, well, you love your dad, but then he's kind of, he's your dad. How do you get along with your dad? I mean, can you even talk about this in front of your dad?
No, I totally.
He's not going to smack you, and you're not going to.
I'm the one that kicks him under the chair, because if he's talking too much, I'm the one that'll give him a little nudge under the chair with my foot, like, come on, Dad, be quiet. I got a schedule to keep. Or if there's something in the office that they want to discuss with him, whether it be good or bad, oh, Kerry, can you please bring this up with your father? Can you please help us out? But in the initial time of working with my dad, it was hard, because I was under scrutiny from the beginning, because I was the doctor's daughter. And so I made sure that it was really tough. And we worked in a very large team. He's always had a restorative dental hygienist. I was the third full-time hygienist on board, so I wasn't the top of the totem pole by any means, but I earned respect from just doing what was right for the patients, buckling down and doing what was right, and that's what his philosophy has always been. And so my initial thing was, I'm going to work for you for a year, and then I want to go to Bermuda. I want to go away. And he said, no, you got to follow me and listen to what I say. I'm going to teach you all the things you didn't learn in dental school, and I'll make you a good hygienist, and then you can go out and work for somewhere else. And after a year, I said, it's working well for me. Can I stay with it? And then we got involved. So we work clinically together. We work for Oravital together. And ironically, I bought the house next door to him. So, and I'm not the only child. I have one of 3. So we have a very good relationship. And it can be. And I didn't realize how much my dad knew and all the things that he did until I actually worked with him. So I have more respect for him now that my siblings might not even realize.
Now, what I did, Howard, is like when Oravital came along, it was a breath program when I started. And when Ann told me that the same bacteria caused breath odor and caused gum disease, and she had 90% success rate, I said, stop there. I said, what did you say? She said, the same bacteria causes disease. And I said, you're controlling breath odor. She said, yeah. I said, what happens to the gums? She said, they get a whole lot healthier. So I turned to Kerry and I said, Kerry, make it the perio program. I'm too busy to do that. So she turned it into the perio program we have today. So she's done a great job. And, it's a pleasure to work with your child. And you kid a lot about it. But they've got the best intent, and we take care of each other.
Yeah.
But it was tough on her, because she'd try and have relationships with people in the team, and she had to be good at what she did, and she couldn't be seen as a snitch or, throwing them under the bus and things like that. So she had to find ways of getting me. I think it worked out better because she helped me be a better dentist, because she'd make sure I diffuse situations. And if I'm doing things wrong, she says, Jim. What? Jim. She doesn't call me Dr. Hyland or Dad. Jim means I have to pay attention.
Yeah, and I think we're a neat duo because I bring the hygiene perspective as well as the dentist perspective. So when I'm talking to dentists, I can say, hey, from the dental perspective, I believe this is what it is. However, your team might feel this. So it's a good balance we bring when we present information and just in general.
I just got back on an 18-day trip to Asia, and I took 2 of my 4 boys, Ryan and his brother Greg, and whenever I take one of my 4 boys, it's not even work.
No.
Yeah.
It's just a father-son outing. I mean, it's just like I just saw that. Then we went to Johannesburg for 10 days, and whenever I work with my kid, I always think it's not even work. It's like I would do that for free.
Yeah, it's a great relationship we've been able to build, and we're so much stronger for it. And you're right, it's not like work. It's fun to go away, and our families don't mind if we travel because we're traveling together, and it's wonderful.
So do you always hit them with an open hand so you don't leave a mark? Or is that your trick?
Pretty much. That's pretty much. I make sure I always hit them below where anyone can see and all the rest, yes.
Well, can we really look forward to some online CE on this?
We would honestly love it, or any courses that you want us to run or offer. We've done some 6-hour courses in Toronto on education about biofilm sampling, breath sampling, treating breath patients in perio. So we've done many things that way.
Well, yeah, I mean, the whatever you want to do, because I know they're all out. The number one thing they're asking about on Dental Town is periimplantitis. I mean, in fact, I got to show you. Let me show you this. This is while we've had this interview. Hi, Howard. My name is Holly, and I am a dental hygienist in the Atlanta area. I listen to your podcast regularly. I have an idea for one. Can you put a guest about implant carie and periimplantitis? My dentist does a lot of implants. I want to learn more about how to care for patients. I mean, I get periimplantitis several times a day. I get a lot of oral systemic links.
Yeah.
And if you really think this is linked to Alzheimer's, I mean, that's.
Do you want me to mail the stuff to you?
No. I want you to meet with Howard Goldstein and start building some courses.
I meant about the links.
And the other thing I got to tell you, what makes me the most excited is United States, Canada, Australia, New Zealand, Western Europe, these dentists, they got access to 20 different ways to get information.
Yes. Correct.
But when we're in Indonesia and Malaysia and Africa and Tanzania, and it's just dental town.
Yeah.
And I have been in so many private dental schools in Asia, where all their textbooks are 10 to 20 years old, and they just sit around on a dental town screen all day long, and all those courses are free, and there's 210,000 dentists posted 4 million times, and these dental students just tell me that it's just everything. So when you do a course with dental town, you're not making a Canadian dentist a little better. You're taking a dentist from Dar es Salaam from 0 to 100. I mean, it's just amazing, and that's what the internet is going to do. It's going to flatten society. It's not going to be the rich first world 20 countries and the 200 third world. The difference between the third world and the first world is collapsing at the speed of the internet, which jumped into the cell phone in 2008. And I think that might be the biggest game changer of the century, was the internet marrying the cell phone, and we're leading the way with Dental Town, and I get more goosebumps from what we're doing for dentists in the third world than what we're doing for a bunch of rich dentists in Toronto.
Well, we haven't talked about geriatric care, using this rinse for people in old age homes, because there's a 10% reduction in deaths from pneumonia if their teeth are brushed twice a week.
Why don't you tell them about the study that'll be coming out in the AGD?
We did a study where the University of Toronto asked us to do a study at the TRI, the Toronto Rehabilitation Institute. Now, these are people who are quadriplegics. They can't brush. They can't do anything. In fact, they can't even open their mouths, many of them, from the spasms they had. So these people had terrible breath odors, have oral systemic links, and are having terrible periodontal conditions, and it's general anesthetics to do anything for them. So what they did was they used the techniques we mentioned with brushing and soft picking, and they did microbiology ahead of time, they did period sharding ahead of time, and then they did after just brushing and using soft picks, and they saw huge improvement. Then these people can't rinse and spit, Howard. So they simply took the toothbrush and dipped the rinse in the toothbrush and brushed their teeth, and they couldn't brush the inside of their mouths, okay? And they measured the same thing again a week later. There was 100% improvement again just from brushing with this. So when you look at institutional care and people that can at least rinse and spit, this is another avenue for this type of treatment.
Okay, well, here's the data that I think is the most real for the U.S. Sorry, I don't know what it is for Canada, but in the U.S., 4.6% of the women are going to spend the last few years of their life in a nursing home, and they're going to get one new root surface cavity for every month they're in the office. So after 1 year, they have 12 root surface decay, okay, so here's the bottom line. So I went on a mission, and I went to about a dozen different nursing homes over a course of a year. And here's what it is in Arizona. You got a certified nurse assistant, a CNA. She makes $11 an hour. She's almost never was born in the United States. She has a wing of 20 people, and she's got to do everything for them.
For those people.
Everything. So brushing your teeth is in the laws of eating and going to the bathroom and taking a shower and getting dressed and
just not
fell
up there.
down in the shower. And every time I ever saw anybody get brushed, it was a Dixie cup, dip a brush in the water, put a pea size on there, scrub the front two teeth twice, rinse it back in the Dixie cup, spit in the cup, and they're done. And the poor girl, she should have been getting paid $30 an hour, and she should have seen half the patient load. So if my homies are listening and say, well, you're not going to change that.
No.
But I got a mom in the nursing home, or I got a grandma in a nursing home. How would you specifically answer nursing home root surface decay?
You have to look at the diet, and you have to help them with the diet first. So you've got to try and reduce the refined carbohydrates. But if they can't chew well, that's what they go for.
Okay, so let me address that. So I in every one of these nursing homes, I talk to the kitchen people.
Yeah.
The kitchen people says, we can't make stuff where you have to chew up because they don't have any teeth. They have dentures and partials. So you know what the cafeteria food is? Macaroni and cheese, cottage cheese, lemon meringue pie, pumpkin pie. And everybody's happy if you feed them carbs that don't require chewing.
Yes.
So, I'm not to...
Okay.
So when you talk about refined diet, you got to be kidding me.
So what I haven't said to you is that decay is a biofilm. If you give them amoxicillin in the rinse with nystatin, you control the bacteria that cause decay. So we have our microbiologist in our lab is a PhD, and her specialty was strep mutans. And our studies we're doing now...
Can I podcast interview her?
You could.
Think she'd be up
Yeah. She's going to be stuffy. I don't mean that
Oh,
negatively.
I love that stuff.
She's is it Russian background? And she's straight, so she's harder to interview, but she's knowledgeable and she's competent and she
she's
knows her
passionate.
stuff.
And she's
really
Russian?
She's passionate about what she does.
And she's Russian?
Yeah.
Do you know why Donald Trump is so against immigrants and why he wants to build a wall and stop all immigration? Because all of his ex-wives are from Russia.
Amen.
But with that,
I would love to talk to a microbiologist. To me, that would be better than an opera or something.
we can set it up for
You
sure.
have to talk to Anne as well. Anne is 78 years old. She works full time. She's the longest practicing hygienist in Canada.
Oh my God!
Her
no way.
her number is number 6.
You know she's going to kill you about
in
all
dental
this stuff,
hygiene.
right?
Thank you.
Here's my cell phone and
Okay.
email.
Yes.
And fix me up with both of them.
You know what
I will.
she is, Howard? She's the salt of the earth.
Yeah, she's awesome.
And she's done so much to develop this system. What I'm trying to do is just promote it because I think this can revolutionize how we take care of periodontal disease in addition to what we're doing.
Yeah.
Okay, but I don't want it to be a firework. Giving the rinse is a firework. You got to convince people to take care of themselves, to do it differently. And the techniques we tell people to do, Howard, it works 90% of the time. It's so predictable.
And if I rub it on my head, will it grow hair?
Absolutely.
Unbelievable. I'm in. Well, hey, we are out of time, and your passion just exudes. And I've always said it, whenever a dad or a mom is so passionate in career that one of their babies follows them into it. This is your proof in the pudding
Absolutely.
that you are the real deal. Because
Thank you.
when
I'm
you're
very proud of it.
When you come home from work and you say, God, I hate this steel mill, and I hate the coal mine, and they yell at their kids, whatever you do, don't end up in a coal mine like your daddy.
Yeah.
But you were coming home saying, whatever you do, my job's awesome.
Yeah.
And your little one followed you. So love your passion, love your enthusiasm. Thanks for all that you guys do for dentistry.
You're welcome. Thank you
And
very
I'm
much.
sorry your neighbors to the south are complete insane hillbillies. I know you go to bed every
We're
night
going to get
wishing.
all the good Canadians coming up here
Oh
soon.
my God! I know you guys go to bed every night thinking, why couldn't our southern neighbors be Scandinavia? Why?
No, what I
Why
do
did
is
it
I
have
turn-
to be the United
I turn
States?
on CNN and I go to sleep early. Okay.
Oh my God! Oh my God! I'm so. Oh, but you lost that. You lost one of your politicians,
Yes,
Ford.
we did.
Yeah.
Ford.
Yeah.
And what did he die of? He had a
Cancer.
He had cancer.
He had
Yeah.
cancer. He had many different.
He had a type of stomach cancer that was rare. He was a guy for the people. He had a bit of the.
say his name.
Rob Ford.
Ford.
Rob
It was a
Ford.
little bit of the Peter principle. He got promoted beyond his ability. As a local councillor, there was no one like him.
Yeah.
Somebody that was in the trenches, fought for his people. He was into only spending what you could, making people accountable, but he had some personal demons and he didn't deal with them well. And he had a drug addiction and an alcohol problem, and he tried to hide it. And if he'd sought help and said, look, I need help, and admitted it, perhaps he would have been different.
But you know how many funerals I've been at where the dentist? No, I'm serious.
Yeah.
Where the dentist is dead and the staff's all crying because they're all sitting there saying, "Yeah, every one of us at one time came to the office and caught him on nitrous oxide.
Yes.
He gave me a prescription to go fill for Vicodin and told me it was for his mom, but we knew he was eating it.
Yeah.
And then here he is, and he ODs."
Yep.
And everybody's sitting there saying, "Well, why didn't you get him
something
help?
about it, yeah.
Why didn't you get him help?" And everybody was looking the other way because what they forget is that some of the most extremely fatally flawed humans
Yes.
can do wonderful things. Steve Jobs
Yes.
had some
Perfect example.
huge issues at home.
Yeah.
And there's so many, if you're a dentist listening to this, or you're a hygienist, or maybe you're a husband and wife driving to work at night, and the wife's sitting there and she knows her husband's a junkie.
Yeah.
But he's making $200,000 a year, and he's a doctor, and he's a pillar of society. And people don't realize that not all humans are all good and all bad.
No.
They're a mixed bag. In fact, this is embarrassing to say, but whenever they interview Charles Manson, well, he's an incredibly charming, adorable little person, and he's
Yeah.
one of the biggest monsters in society. So even Charles Manson,
Yeah.
is good.
In some areas.
Is some guy that you'd want to be sitting next to at a bar. He's
Don't
charming.
we
So
see it the same thing in dentistry? Like when I went to school, I was between the two guys who were in my wedding party, the smartest people I ever want to meet. You know how they say you can always achieve whatever you want? I was never going to beat those guys. So I said, okay, I won't graduate first in academics. I'll be best at what I do with my hands. And I did really well. And then I got out into practice and it didn't matter. It was, how did people like me? That was the 85-15 rule. And so fatally flawed people in doing lousy dentistry were very successful at what they did because people liked them.
Yeah.
So it works in our profession too.
yeah. Okay, we're out of time. Thank you so much.
Thank
You're
you
welcome.
again.
All right, bye-bye.
Pleasure meeting, and thank you for taking the time.
Oh,
I
you bet.
appreciate that.